I fear to be a patient. Partly that fear comes from what I know about technical hazards and the lack of reliability in care. Today I have a bone-on-bone pain and osteoarthritis in my right knee. I can no longer jog, which was my passion, or even run 4 steps because I had an unnecessary and now fully discredited knee operation as a medical student, an operation that had never been subjected to proper evaluation for a condition that had never been subjected to a hands-off arm of a clinical trial. My best friend had a severe post-operative complication from a drug dosing error at transition. It almost killed him. My research on errors in care show these errors to be terrifyingly the norm. But the honest truth for me is that the errors and unreliability of healthcare are not the main reason that I fear that inevitable day on which I will become a patient. For in fighting those enemies, errors and unreliability, I am aligned with the good hearts and the fine skills of my technical caregivers. I can use my own wit to stand guard against them. What chills my bones is indignity. It is the loss of influence on what happens to me. It is the image of myself in a hospital gown, homogenized, anonymous, powerless, no longer myself. It is the sound of a young nurse calling me Donald, which is a name I never use. It's Don. Or for her, maybe it's Dr. Berwick. It is the voice of the doctor saying, "We think," instead of "I think," and thereby placing that small verbal wedge, the pronoun "we," between himself as a person and myself as a person. It is the clerk who tells my wife or my son to leave my room, or me to leave their room, without asking if we want to be apart. A close friend called a clinic for her mammogram report, and she was told, "You have to come here. We don't give that information out on the phone." She said, "It's okay, you can tell me on the phone." And they said, "No, we can't do that." Of course they can do that. They choose not to do that. And their choice trumps her choice, period. That's what scares me. It scares me to be made helpless before my time, to be made ignorant when I want to know, to be made to sit when I wish to stand, or to be alone when I need to hold my wife's hand, or to eat what I do not wish to eat, or to be named what I do not wish to be named, or to be told when I wish to be asked, or to be awoken when I wish to sleep. You can call it patient-centeredness if you choose, but I suggest to you this is the core. It is that property of care that welcomes me to assert my humanity and my individuality and my uniqueness. And if we be healers, then I suggest to you that that is not a route to the point. It is the point.